We know from our experts, they say that the transmission is higher, the rate of transmission, and the impacts on the health factors as far as hospitalization, ICU admission on unvaccinated individuals is higher than with the UK variant. The experience with one-dose vaccination is less clear on that.
As the daily COVID-19 case counts keep coming down, there are encouraging signs everywhere. The economy is gradually reopening. At least one Toronto hospital is closing its COVID unit, and more of us are getting vaccinated.
But there's more evidence tonight about the danger posed by the Delta variant. It's more transmissible than the Alpha variant, and some are now suggesting we need to reach 90% of the population vaccinated in order to achieve herd immunity. So joining us now to look at where we are, CTV News infectious diseases specialist Dr. Sharkawy, an epidemiologist and professor from the University of Ottawa, Deonandan. Great to have both you gentlemen back here on CP24 tonight. Dr. Sharkawy, to you first, that 90% number for herd immunity. Do you see us reaching that or getting close?
Well, I think it's perfectly achievable, to be honest. I think if we had looked back to where we were in the early spring, and we were having all sorts of hurdles with not only vaccine procurement, but actually logistically getting doses out to communities that were hardest hit. A lot of us would be very skeptical about that number, but the way in which momentum has really been ramping up these last few weeks, the dent that we have put into the issue of vaccine hesitancy, I think has really created a very positive spirit throughout Canada. And I'm personally very optimistic. I think there's no reason why we can't achieve that. But we have to make sure that in order to do that, we remain very focused, we remain engaged. We make sure that everybody who needs these vaccines gets access to them, and we don't forget about them. And those are still challenges that I don't think have been met perfectly.
Yeah, access has been a challenge for so many people logging on online today for that second dose opportunity. Ray, what's your message to those who may have found it frustrating and possibly didn't get an appointment today?
That this is the nature of the game. There are going to be some administrative challenges, but we all know what we have to do. We've got to get a second dose into us as quickly as we can if you're past 3 or 4 weeks already. So there's a lot of optimism here, as Dr. Sharkawy pointed out, and we should not let these administrative hurdles, these frustrations, dampen our spirits, because there's a lot of good to take away from this. And I share his optimism. I think we will come close to reaching that 90% mark for a number of reasons, including the fact that we have extraordinarily good vaccines. We have high uptake or desire for uptake amongst Canadians, and we have the option of vaccinating children, which will help us reach that goal.
Absolutely, Ray. It is good to see all those encouraging numbers. If we are sort of getting close but not close enough, and we realize there is a percentage of the population that maybe wants to, but we need to tip them over the edge somehow to sort of get those jabs, do you think we should be incenting people at all beyond just the potential health benefits to get the shot? Some sort of payment plan or some sort of, lottery like we're seeing in some states?
Yeah, I'm not entirely comfortable with incentivization plans that involve money, because you're essentially buying people's cooperation for the day. You're not winning their hearts and minds. And there is some coercion involved there. For example, if you're poor and you need money, but you're vaccine hesitant, you're going to be tipped towards accepting a vaccine despite your hesitations. That doesn't rub me the right way. I'd rather win people over in their hearts and minds by teaching them good science. But there are other kinds of incentives we can offer, like rolling out the domestic vaccine passports, which is a hot button topic, but getting access to things like a sporting game that Dr. Sharkawy attended last week's Leafs game, or a theater or restaurant, if you agree to be vaccinated. If you don't get vaccinated, you have to get a negative swab test, so no one's being excluded. Showing a series of societal incentives that way, without too many disincentives against those who don't get vaccinated, will help tip that scale a bit further. If we don't reach herd immunity, we might come close to it. We get herd effects. We get population-level practical immunity. So this is not a dire situation if we don't quite meet it.
Mm-hmm. Yeah, the optimism is there, though. So many people got to a patio over the weekend. It was weird seeing strangers to me when I was walking down the street. And Dr. Sharkawy, the COVID unit in your hospital shut down. What was that like when you learned that?
Honestly, it was, very emotional in a good way. I sort of likened it to giving away your daughter at a wedding to someone that you're happy to see her start her future with. I mean, I don't have a daughter, but the truth is, I'm just overwhelmed with joy when I look back at so many hard times throughout this pandemic, so many of my colleagues who toiled, families who struggled, memories of calling up loved ones in the middle of the night to share terrible news, having people say their last goodbyes to their parents through an iPad. Putting those memories behind us, I can't tell you how that makes me feel. I can't tell you how much relief and what a sense of accomplishment that we can put this really tragic chapter in our history behind us and hopefully learn, appreciate all of the problems that we identified, all of the inequities, all of the disadvantaged people out there, those who suffered the most, recognizing that, appreciating that, and moving forward towards a hopefully more just society, a society that values people and understands the meaning of the word essential. I'm filled with hope that hopefully this was an opportunity to bring more of that narrative to light, to understand that, but more than anything, to give an opportunity for people to love and cherish the experiences that mean so much to themselves in an organic way. We are desperate for that. It's been 15 months of really difficult life experiences for too many people.
Absolutely. So, Dr. Sharkawy, after you tweeted that today about the fact that your COVID unit has closed down, did you hear about others that are either close to closing down or have closed down? You're the infectious diseases guy. We assume people come to you with this.
Well, I think there's going to be some variability. You have to remember that there was a lot of transferring of patients between different parts of the province to balance out issues and to allow healthcare capacity to function. So I think it's going to take longer in places like Brampton, for example, and other parts of Peel Region where I live. But I think the trend consistently across the province of Ontario has been a good one. ICU capacity is getting better uniformly throughout the province. The number of admissions overall is reducing every day across the province. So I don't know that every other medical and healthcare institution is going to close down their COVID units quite as quickly. But I think we're definitely trending in that direction. And I can certainly see a domino effect happening over the next few weeks, where all of those areas that were really hard hit are finally going to be able to hit that release valve and give the healthcare staff a much needed break. And really, more importantly than that, get everybody else who's been suffering, waiting for non-COVID related care an opportunity to get that. That's something that I think we direly and desperately need to address, because there's a lot of people who've been suffering because our resources have been tied up because of COVID-19.
Absolutely. We appreciate this conversation. Dr. Abdu Sharkawy, Deonandan, thank you both so much.
Thank you.
Thank you.